Hi, Dr. Pelto here. I want to go a little bit over something that's quite a problem for many of my patients. It's called gout. Gout is one of these things. It happens usually in the big toe joint for us as podiatrists. You can see here a very red, big toe joint that someone has. This is a patient that came into the office. And some people, if you've had it before, you might know you have gout. If you've never had it, anything that touches your toe is going to be painful. It can also happen in other parts of your foot, like the middle of the foot and other areas. The first thing is how long you've had symptoms. So gout is something that it's going to be a real short term. It's going to be like 12 hours, 24 hours, a day or two, and you're going to know it. You're going to be limping. You can't even put on a shoe. Anything that touches it's going to be painful. Have you tried any treatments before? Most people, before they come and see us, if they've never had gout, they may try icing it. They might try Motrin, ibuprofen. Those are anti-inflammatories. If you've had it, you may have some medications sitting around. We're going to go over some of the medications and some of the treatments for you. Those are some good questions. How does it impact your life? If you can't sleep, if you can't put a shoe on, if you can't kind of walk around without pain, you should be seeing someone. And, why do you want treatment? Those are some of the main questions I ask my patients. How long does it take to get better? This is what everyone asks me. When you have a gout flare-up, let's talk about a difference. There's a difference between a gout flare-up and then there's chronic gout. A little bit different. A gout flare-up is where it looks red. It almost looks infected. It looks painful. That it should take days if you get treatment to get better. It should get better in days. It shouldn't last long term. Then there are chronic gout, some patients that have kind of chronic gout or recurrent gout. That can really depend on how long you've had it. And it also depends if you've had some of these other things like gouty tophi. We're going to show you some pictures about what are some of those other things. So what's the process of getting better with gout? First, you have to learn about the foot problem, kind of what causes gout and things like that. Collaborative treatment, it means your podiatrist will all do something and you're going to do something. The goal is to get back to pain-free movement as long as the joint hasn't been affected. There are some joints that can be affected by gout or this type of arthritis in the big toe, okay, in other parts of the body. Here's some examples here. So this upper left-hand picture here, it's red, it's hot, it's swollen. This patient does have a little bunion, but there's a difference between a bunion and gout. A bunion is a bump on the side. This patient has a bunion and also has gout. So a red, hot, swollen joint. Not every person that has a bunion has gout, but these patients do. Okay. This almost looks like they have a sandal line here, but it's going to be red. It's going to be hot. It's going to be swollen, and anything that's going to touch it, it's going to hurt. What is gout specifically? Well, gout is a buildup of this stuff called uric acid in the joint. You can see this picture right here, these little crystals. And you can see, actually, this is a patient of mine that has the crystals popping out. This is a real severe case of this gout. And this actually went down back to normal. It took months and months and months. And I had to scoop out some of this chalky, it looks like chalky white stuff. You just kind of scoop it out and you treat it as if it's an ulcer or a wound. You kind of treat that. You kind of take it out, you treat the wound, and then they come back and you kind of take out the wound. Sometimes you actually have to open it up and surgically take out all this gouty, chalky stuff. There are times when we're fixing a bunion and we actually find gout crystals inside of the joint. That's going to make it painful. So a lot of times we'll find it as a secondary kind of mechanism. Now, why is this important? If you have gout here in your big toe, you might have it other parts of your foot. You might have it for other parts of your body as well. And that's kind of the dangerous thing, that this can affect other parts of your body as well. That's kind of beyond the scope. That would be more with a rheumatologist. What are the causes? Everyone asks me, well, what do I have to stop eating, doc? How can I stop this from happening? In my experience, this one of dehydration is really the most common thing that I see in my patients. Dehydration, they come in, they're dehydrated, they're doing a lot of yard work, they're maybe drinking alcohol that dehydrates them. Maybe they're on a new diuretic that's dehydrating, and that causes a buildup of this uric acid in the joints. This is the most common thing that I see in my practice. It can also be caused by things that you eat. So these are called high purine foods. So shellfish, red organ meat, red meat, and then sweet juices. These are things that can cause it. Okay. And if you have chronic instances of gout, you're going to want to avoid this. Alcohol, kidney disease, high blood pressure. So either you need to kind of excrete the uric acid, and if you have kidney disease and other things like that, it can affect it. So you want to talk to your doctor But I don't find that when you have an acute gout attack, you can just stop eating shellfish and it's going to make it go away. It's more if you have chronic or a recurrent instances of gout that can affect that. What are the diagnostic exams I like to do in the office? This first one is a uric acid exam. So basically, it's a blood test that you get, and it'll say if it's high or if it's low, depending on the number. Many times, though, when patients come in, I can tell it's gout, and I get this exam, and the exam is normal. What's the reason for that? Well, what happens when you have an exam, it goes up and then it goes down. And if you catch it, if you test it when it's on its way down, it might show that it's a normal value. So depending on when you test the blood, it may show a normal value. What other tests you can do? You can look at an x-ray, because if patients had it for a long time, you can see here, it looks like almost like you're missing a piece of the bone. You see how the normal bone right here on the side? If you look at this one, it almost looks like it's something's eaten, something took a bite out of it. We call it rat bitten or eaten. It's eroded on the sides, and it tends to save the cartilage here of the joint, and it eats around the sides of it. And that's a patient that's had long-term gout, and it can eat away the bone because those crystals can kind of eat away. It might look like an infection, especially if you have a wound in that area. You might be misdiagnosed. Someone think that wound caused a bone infection, whereas it's really gout for this patient. Can you take crystals out of the joint? You can. It just kind of, in my opinion, it's kind of mean. It hurts a lot. If you are in doubt, you certainly can what we call tap the joint. So you numb the joint, and you put a little needle in there, and you take out some of the crystals, and you look at them under the microscope, and you can see certain things. I remember this from school. I don't do that. Usually rheumatologists do that. So if you go see a rheumatologist, they might do that. I just tend to treat it. How do I treat it? Well, I put this thing together to help you a little bit. Gout treatment evaluator. This is something that I like for my patients. I like to simplify things. There are certain things that are most effective, other things that are least effective. So you want to focus on what's most effective to take away your pain versus the least effective things. Once again, you have to talk to your doctor about this, but I put it in categories. You want to reduce the pain, you want to reduce the shoe irritation, and you want to prevent recurrence. So let's start here. If you're in pain, this is what you're concerned about. I find if you're in pain, it is gout. I like cortisone injections. Cortisone injections is the best way to get rid of that pain for you right now. Second best is oral prednisone. Once again, it doesn't work directly in the joint. This is kind of like taking prednisone, shooting it right into the joint. Now, does that hurt? Yes, it hurts. Okay. Is it tolerable? Yes, it's tolerable. And you're going to feel pretty much better instantaneously. That's why I like cortisone. Next best would be oral prednisone, which is like a Medrol dose pack, which are one of these like blister packs. We have 5 pills, 4 pills, 3 pills, 2 pill, 1 pill. Other medications, there are anti-inflammatories like indomethacin, and then there's colchicine as well. So these are some of the ways that you could take this. Once again, you should talk to your doctor. Less effective for really acute gout attacks. Okay, but you can do these as well. I like cortisone, but then these other ones you can do as well. Icing and contrast baths, not much. The topical stuff, the CBD creams and things, not much. Along with cortisone injection, if you're in a lot of pain, I'll put you into a walking boot, because anything that hits it is going to hurt it, or a surgical shoe or a soft shoe or a sandal, something that does not irritate it. It's going to be helpful. If you have a wound where those crystals are kind of popping out, I like to put people in a walking boot or a surgical shoe to prevent rubbing and irritation. And then there are a couple of ways of preventing recurrence. Once again, you should talk to your doctor. That's not the purpose of this little video. Eloric and allopurinol are some methods of preventing it from coming back. So if you're dealing with gout, you should see someone. If you have any other comments, put other comments, kind of what works for you. I know there are a lot of not natural home remedies and other things like that that can help, but these are the things that I found in terms of medical treatment to get you better fast. If you are not getting better with the natural remedies, okay, don't just soak it in salt water. Okay, don't just drink a juice. You don't have to suffer with this, especially if you have recurrent instances of it. It would be good for you to see someone. Okay. Once again, I hope you guys found this beneficial. Please like the channel, please subscribe, and tell me if you want to learn other things. Put your comments underneath it. Okay. Thanks, guys. Have a good one.